Hello, this is Matt Janucki, and you're listening to Inside Men's Mental Health, brought to you by Psych Sessions. Here we explore this thing called masculinity and its impact on men's mental health, relationships, and communities. We'll learn together through conversations with thought leaders, innovators, and industry experts. Our conversations will also help us understand how these experts became interested in men's mental health and the ways their journeys have made them who they are today. In this episode, I spoke with Dr. Paul Sharp, who is a senior lecturer in health behavior change and sports psychology in the School of Health Sciences at the University of New South Wales. Paul has done extensive research on how to engage men in health interventions, as well as the ways that men build social relationships. His work has informed a number of interventions, such as Buddy Up, which is a suicide prevention program focused on helping men build healthy relationships at work, as well as In Good Company, which is a website and podcast developed to help men build healthy social connections. Paul and I were together in Vancouver, British Columbia, working with the University of British Columbia's Men's Health Research Program. It was great to be in the room with Paul and talk about his work. Thanks and enjoy. So today on Inside Men's Mental Health, we're doing a conversation with Dr. Paul Sharp. Dr. Sharp is a senior lecturer in health behavior change and sports psychology in the School of Health Sciences at the University of New South Wales. Paul, your research examines the influence of sociocultural and gender-related factors on men's health and health-related behaviors. You're also an academic member of the University of British Columbia's Men's Health Research Program and the Reducing Male Suicide Research Excellence Cluster. And you also host the podcast In Good Company, which is focused on men's social connections. Paul, great to talk with you today.
Thanks very much for having me. Happy to be here.
Yeah. Since you host your own podcast, you're saying it's nice to be interviewed instead of the interviewer.
Well, it feels a little different being on this side. Yeah, I don't know. We'll see.
What I always like to ask people is just how do they get started in men's health work? So just curious about that for you. What was your journey? How did you get here?
Yeah, it's a good question. I think I've always been an introspective person. Being a man, there's a direct relationship that I can read the research and think about how that is applicable to my life. But I was always very active. I played soccer, competitive soccer growing up, played university level soccer. And so my schooling, I went into human kinetics, right? So study of human movement and the human body and health behaviors, behavior change, mostly around physical activity and diet, encouraging people to be more active for health benefits. And through that process, I started working on gender-specific programs for men, getting guys in, and I actually facilitated them. So I got to interact with the men themselves. And through that process, the guys were talking about, hey, this is great. I'm losing weight. I'm sleeping better. What about my mental health? Which is, we've talked about for so long how stigmatized men's mental health is. And I was like, well, what is it about this space, about this context, about getting guys in, especially around the pandemic, right? That they are open to talking about this. So that's just unfolded into my whole research program as is, exploring men's mental health.
I mean, it's a little interesting to me that you weren't prompting them about their mental health. They were saying, hey, I'm looking for more support and they were interested in that. Like, that's just, I don't know, it's real interesting. It seems maybe kind of a bit of the counter narrative, right? That you have to like push guys maybe to get to that space, but they were kind of asking for it.
Yeah. Well, we have a quote. It's actually the title of one of our papers. It's one of my favorites. And it was a guy that said, people say men don't talk. Well, that's bullshit. Because if you get them in the right context and you get them in the space where they're feeling comfortable, they're feeling safe, they're not going to be judged for what they say, right? There's not this hierarchical power necessarily between a clinician. It's not a biomedical lens that's saying, you're sick and I'm here to help you.
Yeah.
It's a reciprocal back and forth. It's just a conversation that these guys were having with each other. And they absolutely recognized that mind and body are connected, that mental health is part of their total overall health and well-being.
So again, maybe we're spending a little too long. I'm just curious, when you talked about that space, right? The space was safe for them. What do you think it was about that, the space, the environment that helped them feel safe?
Yeah, it's a great question. And I think there's different ways to think about it. Some of the conversations that we've been having in this RMS week while we're here is around this idea of social capital, right? So it's essentially a currency that you have that you can exchange, right? So if you are in a space, such as a sporting context that's traditionally masculine, that you feel secure in your masculine identity, you can use some of that currency and trade it out for perhaps a bit of vulnerability, right? Without completely compromising your self-view or how other people are perceive your masculine identity.
So there's something about that, the capital that was important in this context.
Right. It's a men's program, so it's all guys. They are of similar backgrounds, experiences, life circumstances, right? They were all there to improve their health through a lifestyle program and lose some weight. So that resonated, those challenges resonated with each other.
Yeah.
And they start talking about work stresses and how that impacts the foods that they're craving or eating. They talk about their relationship struggles and how that is impacting their drive to work and stopping in, and instead of just grabbing a coffee at Timmy's, they're getting a couple of Timbits on the way as well.
Yeah. So it seems like, so was it at this point in time then, as you're having this experience with talking with guys about nutrition, diet, exercise, and then it's this entry point into mental health where you decided you wanted to do more work explicitly in men's mental health, maybe even say like you wanted to make it a career? Is that something around that?
Yeah, well, I'm not a clinician by background, right? Which I think is probably the most traditional path to getting into this. So I think that gives me a bit of a unique lens, is I've always had an interest in prevention and primary promotion. Let's prevent people from ending up in hospital requiring clinical care. What can we do to build that foundation of health as well as social structure that's kind of a safety net if and when things do happen in their life? And so for me, that is such the key of like, how do we build community and build culture? And it ties into my past work in the intervention space, but I also did work for the municipal government for a period of time around community building and social cohesion and building spaces for people to gather and congregate together.
So I'm curious about that. That's something that I found that really interesting as a clinician, right? So I have a kind of counseling psychology, clinical psychology background, getting into men's health work, especially talking to everybody here and at RMS. There's all this focus on men's health promotion, right? And that wasn't my background, not really so much of a background on that, like in the States so much, but really a big emphasis here, right? And so I'm wondering if you could talk for a minute about, like, first, what is health promotion? Like, what is that kind of field? Maybe you could talk a little bit about that. And then I'm wondering if we could shift a little into what does that mean to like health promotion for men, right? Because that has some specific implications. So maybe you could kind of start with what is health promotion?
Yeah. Well, I mean, in the grand scheme of things, I think it's relatively a newer field.
Okay.
And as one of our colleagues suggested yesterday, that Canada has really driven the field of health promotion forward. And we can probably speculate on why that may be.
Speculate for me.
Socialized healthcare is probably one of them, right? If we're all paying into a system of healthcare to treat people, instead of thinking of when someone comes in, let's just treat the outcome.
Yeah.
It's, well, is it more cost effective to prevent them from getting in there in the first place? Because it is much easier to quantify how much a hospital bed costs, how much a doctor's wage costs, how much medication costs, extrapolate that over the time that someone is sick.
Yeah.
It adds up quite quickly. So it is the value of, from a cost-effective perspective, as well as a human perspective of increasing the healthy life years lived, builds that case for this idea of health promotion. How do we get upstream to reduce risks of chronic disease? We know that the major contributors to chronic disease and death around the world, at least in most developed countries, are largely preventable.
Preventable, yeah.
And we can do this through the ones we've focused on so far are primarily physical activity, diet, sleep and stuff is coming to the forefront now. But to me, mental health is also, in a way, a health behavior.
Absolutely. Yeah, yeah. So When you think about men's mental health, men's health promotion, there's some, I think, some unique things to think about that, right? To how to engage men, right? And those mental health behaviors, right? Those preventative behaviors and how to communicate messaging to them, how to engage them in that. And you're a world expert in that, right? And so I'm wondering, what are some things that you've learned or what are some things you've been engaged in and how to uniquely think about health promotion with men?
Yeah. I think we come at it because it's a sex and gender is a very hot topic right now. We
Yeah.
see it a lot in pop culture. We see it a lot coming up in relationship, all these sorts of things online around what it means to be a man. And we see this kind of pushback. The pendulum has swung back in the other direction, and it's been emboldened by sociopolitical climate that
Sure.
we currently live in. So maybe 10 years ago, when you talk about gender, people might go, oh, well, you need to build the case for why you're taking a different approach with
Yeah.
gender. The original call that we used to go with is, well, men are underrepresented in health promotion, in programs. You know, if you look at specific health services, they're predominantly women, right? Health and fitness had become quite feminized in terms of engagement. And so it was, well, let's build a space where men feel comfortable in engaging these behaviors, and hopefully we can engage them more in doing that. But now that gender is such a hot topic, I think we're starting to understand the influence that it has on those behaviors, the types of behaviors that we do, how we approach things as simple as our social interactions with each other, right? How we approach our own understanding of self and self-identity and reflecting on how we exist in this world and how we want to show up on a day-to-day basis. Not sure if that answers your question, but we're getting there in a roundabout way.
Yeah, yeah. Just I think you're talking about like I think what I hear is just the complexity of trying to think about communicating a message, right, through the complex socio-political landscape, right? But I'm even thinking of just the thoughtfulness of trying to engage men. I'm thinking of something like Buddy Up, right, where I know there was a lot of thought and care in trying to think, how do we promote this suicide prevention service campaign through the messaging, right, as well as the imagery, and in a way to engage men. So it's like, how do we bring men in, but also how do we not, and you can correct me if I'm speaking incorrectly here, like, but not totally reinforce stereotypes, right? And so that some of that, I think, challenge around health promotion, or how do we engage men but not reinforce things, right, is, I think, a challenging landscape.
It really is. And we walk the line all the time. We're constantly reevaluating how we do that, right? So we can certainly synthesize some principles. One of the challenges when you start doing that is you start to focus on the majority, or historically what is traditionally masculine, right? And you start missing out on subgroups that maybe that doesn't resonate with.
Right.
The example we used before around sport, right? Sport historically, at least in the research, has been a really key avenue for engaging men, but you're only engaging a certain type of men,
Right.
Men that have had positive experiences in the past with sport, men that continue to watch sport or follow professional sport. And it works. There's a reason that it is used so often, because it does engage a lot of guys, but it doesn't engage all guys. But in terms of principles, there's, as you say, the color, the design, taking more masculine colors can actually help to engage guys. One of our early pieces that I always use as a anecdote is we did a focus group with men working in northern British Columbia in trucking industry.
Okay.
And we understood the importance of making sure that the imagery and stuff resonated with them. And not being well versed in that world, we went out and we found some Google images and we put them on the thing. And it had all this beautifully summarized masculine language to engage the guys. The guy took one look at it and he said, "Oh, that's a European transport truck, not a truck we would have in Canada."
Okay.
And he put it down. He says, "This isn't for me." He didn't even read. So it's important to make sure people see themselves in the material,
Yeah.
that it resonates with them, down to the colors, down to the images, and down to that language. And there's certainly different approaches to language that we can use with men, right? We've done a bit of work around even as simple as words that men will associate with mental health, words that they will associate with feminine sides of mental health,
Yeah.
right? Ones that they consider a little more airy-fairy. And so you got to really be careful in terms of how you present that to make sure you don't lose them at the door.
Yeah, that's a great example of the challenges, right, with trying to engage anybody, right? But including the assumptions we can make about guys.
Yeah.
I want to talk a little bit about the program that you're involved in now in Good Company, and this is around building social connections in men. Maybe we can start with that and just talk a little bit about why is that important, right? Trying to build social connectedness in men. I mean, we can assume why that's important, but maybe you can just frame the landscape for us a little bit.
Yeah. Well, I think a path and a thread that I've followed all the way through to this point of we talk about getting people to change their health behavior, to change their approach to mental health, to seek health services when they need, all these types of things that we want people to do. The thread that runs through all that is our social interaction and our social connection with each other. It is both a process and a product of health. It is perpetuating and potentially changing some of those masculine norms, right? Because they are relational. We are negotiating what it means to be a man every day through our communication with each other. So having that as an important thread through that, it makes sense to say, well, how do we work with guys, make them more aware of those social connections and the importance of it? And so the research that we did to start this process is basically just going to guys and saying, tell us a bit about your social interactions, right?
Yep.
Historically, the research has said men have fewer social connections than women. They're not as deep. They're not as supportive. Men provide support in different ways. And we wanted to know, is this guys' experiences of it? Do they want better connections? And I think probably one of the most resounding pieces that came out of it was that men are craving closer peer connections in particular, stronger bonds with each other, and they're looking for strategies for how to do that. So that's just been a really eye-opening piece for us in terms of saying, well, okay, then how do we support these guys to do that?
So not just that men are, they want deeper connections. You said men are craving social connections. Like this is something that they recognize that they want and they really want it. And they're looking for strategies on how to help them do that.
Yeah.
Yeah. And so in Good Company is a way to recognize that challenge for men, but also to maybe bridge that gap, like with some of those strategies. Is that the case?
Yeah. I've in my mind, if we're conducting research where we're gathering information from people, you should be applying it back to help them in some way. And so what we tried to do within Good Company is synthesize some of those, what's working for guys.
Okay.
Right? It isn't just, men are bad at connecting with each other.
Yeah.
No, they've got lots of strategies that they have worked out through different trial and error or through what's worked with their relationship with women, what they've been coached to do, these sorts of things. So we took those strategies and framed them into, first, how do you create a connection in the first place? How do you make friends? Because that was a challenge for guys, especially as they get older. You move away or you have a breakup or something like that.
Right.
You got to reestablish connections, right? So they wanted to know, how do I make new friends, right? The second piece was then, how do I deepen those connections to the point that, how do I talk about emotional things? What's going on in my life? How do I have check-ins with guys? And then the final piece was probably what resonates with most guys is their willingness to help other men. So it's, what are some strategies I can use to support a buddy when I recognize that he is struggling?
Yeah, that's so important. Maybe I'll be a little vulnerable here and maybe I'm going to share too much, but I guess in the end I can always take it out. But I had this experience recently where first, a while back, I had read this article. It was like a New York Times article or something like that. And this guy had written about his experience of being married in a family and for a while, and his experience of fewer friends over time, and you're in the mix of marriage, children, right? That his experience had been that like men just had fewer and fewer friendships over time in that stage of life. And it was time for him to have his first colonoscopy.
Yeah.
And it was like his wife couldn't take him. And so who is he going to call to pick him up at his colonoscopy? And he kind of had talked with some other guys, and it was kind of like, yeah, like we were all struggling with this, right? And so it was this interesting reflection on the stage of life. So I turned 45 this year, and similar experience where initially I was going to plan on my wife to pick me up, and then some life circumstances, and she said, I'm sorry, I cannot pick you up from your colonoscopy. And so I had to think, okay, who can I call? And so I had one close friend that I knew I could call, and I felt like this kind of guilt of like, I'm going to bother this guy. Like he's got other stuff going on in his life, but I'm going to call him and see if he can pick me up. And he said, yeah, I'll do it. And again, experience is funny as an expert in the field because this will connect to some of the work that you know about. And he came and got me, and I said, thanks so much for doing this. I felt bad about asking you. And he said, I just was really glad that you asked me. I was really glad that I could give you help. I was really glad to be asked, like that help giving piece, right? And so it's kind of this piece of like in this stage of life, like it was hard to find other guys because not have fewer friends than I used to. It was hard to ask for help, but my friend was really glad to give help, right? And so it was kind of this interesting reflection, interesting personal piece like that connected to some of this stuff around men's social connection.
Well, I think it's such an important anecdote to share because I would suggest that most men, that would resonate with them.
Yeah,
and that
yeah.
They have a very similar story. Like we can all remember the panic of, we'll call it vulnerability, right? Of having to ask for help. It's so against our nature, right? So I think it's always important to reflect on, it's not just other men, right? These are literally our experiences, right? They reflect our own experiences and challenges. And just because we study this stuff doesn't mean we've got it all figured out.
We're still trying to work it out in our own lives too, which I think is important to acknowledge that, right?
Yeah. But imagine, in your situation, there was a need that almost forced that, right? But if you're, let's say it's a mental health challenge and you go, I could probably tough it out, right? Maybe it's a little bit more in that gray area of, I would like the support, but do I need the support?
Yeah.
Even if you do need it, you might still make the argument like, it's not worth the risk.
Right.
Because I don't know how they're going to respond. I don't know if I'm going to be able to keep it together. I don't know how I'm going to react in that situation. So there's a lot to it. And this idea of asking for help, giving help is one that we've been grappling with quite a bit because that concept of giving help, right? Similar to the men in our study, almost all guys are willing.
Yeah.
They want to help because that's a normative masculine practice, right? Being a provider, being a protector.
Yeah.
But being on the other side of it is what drives that silence. And so some of the men were saying, well, I can't explicitly ask, right? It just isn't going to happen, right? It's not in me. So I would prefer if someone would offer me help and then I could accept it.
Okay.
But then you look at the other side of the coin and the guys are saying, well, I don't want to presume or marginalize them, put them in a vulnerable position by saying, hey, I've noticed some things. I'm here for you if you need me, right? And so this all kind of continues to contribute to a lack of conversation, to the silence that we still have. And it comes back to that relational piece. I'm going to use this in my presentation tomorrow, but I was trying to think of a metaphor for this. Being Australian or being in Australia as a Canadian, surf culture is very popular.
Okay.
So I've given it a hand, given it a try. I'm terrible, right? I can't catch a wave, but here's my metaphor.
Okay.
Let's say you are out there as a surfer trying to catch a wave. a bunch of different things need to line up for you to catch and ride that wave in, right? You need to be able to spot the opportunity, spot the wave coming.
Okay.
You need to pull the trigger at the right moment to ask for help when that wave arrives, and then have some continuity through the conversation. But sometimes what happens is a wave it won't look like much, and then it'll come and, oh, you missed it. And you're sitting there and you're going, oh, did I just miss my one opportunity to ask for help, right? I can continue the metaphor forever, but sometimes the wave will sneak up on you and you do ask for support and it bowls you right over, right? There is a risk still to this
Sure.
day. I'm not saying every opportunity is going to pan out, right? Sometimes you ask the wrong guy at the wrong time and they might ridicule you for it, right? We had plenty of stories of that happening as well.
Right. Yeah, it's always a risk,
Yeah.
right? There always is with the risk comes the potential benefit too, right? Of receiving that support, which you're not going to get that support, right? If you don't ask for it.
Yeah. And persistence is often key. We
Okay.
talk about it with clinicians as well, right?
Yeah.
Like your first point of contact with a psychologist, psychiatrist, that might not be a good fit
Yeah.
for you. So you might need a bit of persistence to find the right person that has the right strategies that you connect with. It's the same with peer support, right? You might not get the best response, but sometimes everyone is reflective. So that same person might come back to you a week later and say, you mentioned something and we missed it in the conversation, but I just want to come back around to it. Like, is this what you meant? Do you want to talk about that a bit more?
And some of the tools that I'm thinking of to help guys kind of frame how people a bit, maybe you can set me right if I'm not doing it right, but frame how people respond. I'm thinking of like the images that you have of your buddy responds like this and your buddy responds like this, right? Maybe you can talk a little bit about like what those are and what that tool is to help people or help guys know like what these kind of peer support responses look like.
Are you talking about on the website?
Yeah, on the website. It kind of has the visuals and it's like, well, if they're like this, they're ghosting you, whatever thing. Maybe you can talk a bit about how that helps guys, what the purpose of that tool is.
Yeah. It's not particularly evidence-based. Some of it is built on our own experiences as well.
Yeah.
But it's just an entry point to get people reflecting a bit on what kind of communicator they are ultimately, right?
Okay.
And just norm some of those experiences, right? Where given the way we communicate now online, right? You can send a message and the ghosters, you never get a message back from them, right? Another one is like the annual check-in, right? Because you get busy with life. And
Sure.
so you try and keep up with people and you say, oh yeah, how are things? And once a year you catch up with them and it's like, oh, I had a kid and I got married and
Right.
oh, wow, I had no idea. So you don't really get into the thick of things
Sure.
with that, right? And my experience with relationships has been that there is an ebb and flow. They change over time. They are contextual. Some people keep and maintain those friendships from childhood all the way through their life. I've certainly been a person that maybe because I've moved around so much around the world, my relationships I've built them in certain places and then moved away and lost those connections. So it's been a process of reconnecting, refinding people over time. But I do find that you can't undervalue in-person relationships, right? Online is great. Zoom is great way to stay connected. But there's something about being in person with somebody, doing things together it's normative for guys, but it builds that physical connection as well that is so valuable to humans.
Right. Yeah, just to people generally. Yeah, I can understand that as somebody who's moved not over the world like you, but just moved around all over the country, all over the states for different reasons. And yeah, you build community where you are, right? And so, and then it's valuable where it is. And then sometimes you can leave it behind when you move on, but you build that important community where you are. And that's extremely instrumental and very important.
Yeah. And it's really the foundation for any support that's going to come later on, right? I refer to it as the safety net. But if you only start to look for those connections when you are socially isolated, when you're feeling lonely, when you're feeling depressed, when you're feeling anxious. It's just an added layer of difficulty to do that. And the catch-22 is sometimes you need to reach that point to then recognize what was missing. Like, oh, I really should make some more connection. I've been focusing way too much on my work these days. But ideally, if we can get people thinking about it a bit more early on, it not only prevents that down the track, but it also is that fallback when you need it.
Yeah. Yeah, I like that idea of the net that takes that preventative piece that kind of takes that work beforehand, right, to build it. And that's hard, right, so that it's set up and ready to go when the crisis comes, when the shit hits the fan.
Yeah.
It's there to help you and catch you. And that's the hard part, right, is you got to do that work beforehand. But how valuable it is. And sometimes it does take, right, that crisis to remind you like, oh yeah, I need to do some of that work to build the net out, right, again.
Yeah. And it's a constant thing. It's the same with behavior. Is what works today for you might not be the same thing that works next week or in the next challenge in your life that you will inevitably experience, right?
Yeah.
So it's about taking courage, facing those things head on and building those resiliencies because they are going to help down the track. And I think we talked about framing and language. Like those are masculine norms and qualities that I think a lot of guys can get behind. Instead of saying, oh, you should really share more of your emotions and it's important to be vulnerable. No, like there's strength in showing up. There's strength in sharing your story because it might just prompt the person on the other side of the table to disclose something that they're going through.
So one of the other things that's going on with In Good Company is your podcast. You've had that going on. Your first season's done. You're moving on to another season. I'm curious to learn a little bit more. What role does the podcast play in this idea of men building social connections? What things are you looking forward to in your next season of podcast? Maybe you can just talk about that a little bit.
Yeah. Well, thank you for the plug.
Oh, yeah, of course.
That. So we were thinking of what is a way that we can help get this information out, right? The website is good because it shows men's stories and it puts, I don't know if we've mentioned that we had them take photos as well as have conversations with us, right? So they narrate those photos to norm those experiences. But not only did they share some of the opportunities and some of their own strategies, they shared a lot of questions with us. This is my experience. This was a challenge I had. What can I do about it? So the podcast was really about unpacking and providing some potential solutions for that. So in the first season, what we really focused on was taking common experiences that men had, again, related to making new friends when they move, having a breakup, wanting to be a better supporter for a buddy that they thought was in trouble. So like, what are some words and phrases I can use? And I would bring in experts and we would just have a chat about unpacking some of those challenges and coming up with strategies that they can use. Yeah. So that was really the focus of the first season. And we're now looking at expanding on that, not only talking to professionals, but continuing forward with identifying some challenges that men have. I guess to foreshadow our next episode.
Yeah, foreshadow all you can.
Is around the rise of non-alcoholic beer consumption, right? Just briefly, there's a lot of challenges with having alcohol, but it's very normative for men. It's a way that you can sit down and have maybe more of a candid chat. It can also be problematic in terms of washing away or having an excuse as to why you may have expressed more emotion or vulnerability than you wanted to. Yeah. Oh, I was just drunk. Right. So having the non-alcoholic beer option allows guys to still spend time in that context, still connect, and it doesn't have that negative health impact, physical and mental. Yeah. So anyway, talking to some guys about, have you heard of non-alcoholic beer? Have you tried it before? What do you think of it? So I just pulled some of my buddies up, some that had tried it and are avid drinkers of non-alcoholic beer, and some that were still a little skeptical, suggesting that there needed to be some more craft brewing options.
So talking to not just experts, but just talking to some just regular everyday guys about their experiences and getting their feedback and perspectives.
Yeah. And I just think that's so valuable because we're social connection there's a back and forth, right? It's reciprocal in terms of I share something with you, you share something with me. Maybe I'm not telling you what I think you should do, but that process is still beneficial to both of us. and often preferred, right? It's non-clinical. So I don't want to be the one sitting up in the ivory tower saying, you should be doing this, do this, stop doing that. No, let's hear the stories of what people are experiencing. Let's understand those challenges. Let's norm what's happening day to day, because it is rapidly changing out
Yeah.
there. It's changing for young men. It's changing for older men, social media, all of these things, fathering. There's a lot of real contemporary things that we can unpack.
Yeah, and that sounds great. Moves the podcast into this place that is beyond just more academic, a little more technical, into just a place that was for just anybody, right? Anybody to listen to that's interested in men's health and things that are around men's health. And that sounds really an exciting next step.
Yeah. Well, I always joke that we're 5 to 10 years behind in terms of how we're helping people to change their behavior or make changes, right? We've relied on this. Let me give you a brochure
Yeah.
with what I think you should be doing. So at least this is a step in the right direction, I think, right? It's a very popular form of media consumption these days. It's hard to keep up with the big names out there, but I think you do need a counter voice. You need someone waving the red flag as to, well, that is actually problematic.
Yeah.
And here's why I think
Right.
so.
That's great. Well, I'm glad that we could talk about In Good Company. We could talk about men's peer relationships. We could talk about the podcast, website. What else? Anything as far as what you're up to, things that you're working on that you think could be helpful to pitch out there to folks?
Yeah, I mean, the next step I think is like, well, how do we translate that? How do we get that into the hands of more guys? And then how do we unpack some specific contexts that are really relevant to guys right now? So the first project really focused on social connection in terms of in-person interactions. And the guys definitely emphasized why they think that needs to be a focal point and be something that everybody tries to strive to increase, is those in-person interactions. And I might also add that complete strangers, right? There's this interesting perception that we don't talk to strangers because we think it's going to end up poorly, right? It could be awkward, whatever. But when you ask people after the fact, the resounding response is that it was a positive interaction, right?
Talk to strangers about like a challenge or something, like just anything.
About anything.
Okay.
Because it's connection.
Yeah,
right?
yeah.
It's connection. It's getting to know people. They're not just deer in the headlights of somebody that's in your way in the grocery store line, right? I had a guy when we were living in regional Australia come up and chat to me, and at the time it was the end of the day. I was tired. I wanted to just go home, and he was like, "Oh, what kind of steak are you getting?" Right? Very masculine topic to talk about. And it was clear that he was just a lonely older guy. And my partner wandered off and continued the shopping. But I was like, no, I'm going to have a chat with this guy. And he told me about how his wife had passed and that he used to be a butcher. And he helped me pick out cut a steak. And I like cooking. So I was talking to him about what I was going to do with it. And it wasn't huge, and it didn't end up in terms of like, yo, this is my best friend and I go over to his house all the time now.
Yeah.
It was just a brief 10-minute interaction, and I like to think that he left with a positive experience, and I certainly did. I'm still talking about it with you, so clearly it left a mark on me. That was a complete aside, by the way, from what your question was. But just briefly, I think areas of interest for me are young men in particular, I think is a real important topic right now.
Yeah.
And where are these guys interacting? Well, video games, right? I think, one, it's a space that's perpetuating some traditional beliefs, misogyny. I certainly experienced it as a kid growing up, but I think there's also positive aspects to it as well, as a release, as a place to socially connect. The online world in general, the influence of social media, how that's impacting our perspectives of health, I think is incredibly valuable. And then I'm still grappling with this idea of how do we increase the health literacy, social health literacy, without formalizing it too much, right? There's been a lot of work on formalizing peer support in clinical settings, right? And there's a lot of value to doing that. But how do you train guys in the wild, right? In your day-to-day life? And maybe it's as simple as giving them some key phrases or just some language that they can use to start the conversation or how to approach the conversation. You don't need to have the answer. All you got to do is listen.
Yeah, we've been thinking about that at our university, at our institution, of those challenges with retention in men in universities, and one of those potentially being men feeling like that space is for them and they belong there. And we've been thinking about, how do we help men support each other, right? How do you programatize that, but not too formally, right? How do you build that? And so I hear that, right, of that challenge of like in the wild, how do you make that something that's accessible, but not too structured? And it's challenging to think about what that looks like, but still important nonetheless.
And key to me there is that peer support doesn't just naturally occur by putting men in the same space, right? It's obviously bringing people together is a key ingredient, but you can't assume that it's just going to naturally occur and be positive. It could actually become a place that's perpetuating.
Yeah.
So there needs to be some process of shifting thinking, of looking at things a different way, and whether that's facilitation, whatever that looks like, norming it through a podcast and sharing your experience going for a colonoscopy, right? Is all these kinds of things, I think,
Sure.
contribute positively to the conversation.
Great. Well, thanks for sharing that. Great to know what you're thinking about and hoping to move on to next. Well, it's been a great conversation. I really enjoyed it. It's been great to connect and learn more about what you're up to and learn more about men's social connections and In Good Company. And we'll be excited to look forward to the next season of In Good Company. Anything else as we wrap up? Anything else to direct people towards, or for people to look for your work? Anything like that?
I don't think I have anything in particular. Just
Okay.
I think getting and sharing some of podcasts such as yours, such as In Good Company, I think it is a great starting point to flag yourself as somebody that is thinking about things differently, right? You don't need to be waving the banner every day that I'm a mental health advocate. And I think just you can subtly show up on a day-to-day basis and with a bit of an attitude that you're open to listening and talking. And when you are talking to somebody, you're in the conversation, you're engaged, you're thinking about it. It takes a bit more cognitive power to do that.
Sure.
But I think just reflecting on those relationships in our own life, and it doesn't need to be a big overhaul in terms of what you're doing. We're not suggesting you need to change who you are or how you think about yourself necessarily, but just reflecting on it a bit. And what's one relationship this week that I can strengthen, that I can show up for?
Yeah, that makes it a little more approachable.
Yeah.
Right?
Yeah.
And not so overwhelming.
Yeah.
Great. Well, it's been a great conversation. Thanks, Paul.
Yeah. Thanks very much, man.
Hi, everyone. This is Matt, just dropping in to say thanks for taking the time to listen to this episode of Inside Men's Mental Health. Do you have ideas for future episodes or feedback on current episodes? Please feel free to reach out to me at inside.mensmentalhealth@gmail.com. That's inside.mensmentalhealth@gmail.com. inside.mensmentalhealth@gmail.com. Take care, and again, thanks so much for listening.